start by introducing our speakers. We have Peter Kempner, who's an esteemed attorney and the director of VOLS, which stands for Volunteers of Legal Service, where he oversees the legal department and pro bono programs. Pete received a JD from the Benjamin Cardozo School of Law at Yeshiva University in 2001 and was admitted to the New York State Bar in 2002. He holds a BA in political science from SUNY Purchase and an MA from George Washington University, thinking also in political management.
That's right.
He's admitted to practice in the Eastern and Southern Districts of New York, and he's accredited to practice by the United States Department of Veteran Affairs. Pete is an adjunct clinical professor at New York Law School, where he's been teaching their Veterans Justice Clinic since 2015. This past year, Pete also received the Legal Services Award from the New York City Bar Association. After we hear from Pete, we're very, very privileged to have with us Senator John Brooks. Senator Brooks is a lifelong resident of Long Island and has devoted his life really to giving back to his community. Senator Brooks is a veteran of the New York Army Reserve National Guard, having served for 8 years as a medic. Currently, Mr. Brooks serves as chairman of the New York State Senate Committee on Veterans, Homeland Security, and Military Affairs, in which he has sponsored numerous legislative efforts bolstering support for the rights and privileges due to New York's thousands of women and men who have served in our nation's military. These include increased and continued funding for the highly successful Joseph P. Dwyer peer-to-peer counseling program and the restoration of education funding for New York's Gold Star families. Senator Brooks' legislative priorities include tackling government corruption, ensuring that all students receive the highest quality education possible, addressing taxation evaluation, and confronting hunger in our communities, protecting Long Island drinking water, combating the opioid epidemic, and making Long Island an affordable place to live and raise a family. I want to thank you again, both of you, for joining us, for sharing generously of your time. And I want to thank Ashton Stewart, our veteran liaison, who's a rock star. And we're so lucky to have him at MJHS Hospice and Palliative Care. And I turn it over now to you, Ashton.
Thank you so very much, Toby. I appreciate it. It is an honor and a privilege to be part of the MJHS Hospice and Palliative Care Department. I'm a veteran of the U.S. Navy, First Gulf War, and this is a new field for me. I'm 6 months into it, and I've learned a lot, and I'm just learning more and more, and helping veterans and their families is what I'm all about. So without further ado, just want to give you a little blurb about hospice. Hospice is a type of care. It's not a place. No matter where a patient lives, the focus of the hospice team is on providing quality of life instead of continuing often painful treatment that will not extend life expectancy. Hospice care may begin once a physician determines that medical interventions will no longer change the outcome for the patient, and a prognosis of 6 months or less is what they expect for the remainder of their lives. The interdisciplinary team, which we have here at MJHS, includes a patient's personal physician, hospice physician, medical director, nurses, hospice aides, social workers. We also have bereavement counselors, clergy, and other spiritual counselors, trained volunteers, art and music therapy, you name it. And when polled, 75% of Americans want to die at home, yet only 25% of them do. There's some reasons for that, and we're going to address a couple of the possible reasonings today. One is advanced directives, something that's crucial to getting prepared before you get to this point of your life, and also supportive services for caregivers, also very crucial to allow people to care for their loved ones at home. And finally, we're also going to touch upon some of the priorities of the New York State Senate Committee on Veterans, Homeland Security, and Military Affairs. Senator John Brooks is here with us today. He's been chairing that committee for 3 years and done amazing work. So we're going to be looking at some of those priorities through the lens of hospice and palliative care. And we have time reserved toward the end of the program for questions and answers. So about 10 till 1, we'll probably end the presentations and follow up with you. In the meantime, please feel free to post your questions in the chat. We will get to them toward the end of the program. And in the meantime, please make sure that your mics are muted until that portion of the program. And finally, we have a 4-question poll at the beginning of this program and also at the end, just so we can measure and ensure that we're doing the most comprehensive, providing the most comprehensive information effectively for these programs. Rosie, would you mind sharing that first poll? And while you take a moment to look at that, I would like to pass it over to Pete Kempner, who oversees the Veterans Initiative at Volunteers of Legal Service. And he and I have worked together for a number of years, and they do incredible work. So without further ado, Pete, the floor is yours.
Thanks so much, Ashton, and thanks, Toby, for having me here today. Give me a second. I'm going to share my screen. All right, so everybody should see that now. So like Toby and Ashton mentioned, my name is Pete Kempner. I am the legal director at Volunteers of Legal Service. And let me just tell you a little bit about us at the start, just so you know who we are and where we're coming from. We're a small nonprofit legal services provider that provides free legal services in a bunch of different areas. But I'm going to focus on our senior law project today that does planning for the future for low-income seniors in New York City. And part of what we do in the senior law project is our veterans initiative. And
excuse me, Pete.
Yeah.
I'm sorry to interrupt you. We've seen your calendar. Can you?
Oh, I'm sorry.
Take a look at that.
Sure. Is that better?
Yes, that's, yep, you got it.
Okay. All right, good. Nobody needs to see my calendar. It's crowded. Anyway, as I was saying, our senior law project focuses on end of life and incapacity planning for low-income seniors here in New York City. And we actually have a number of different initiatives that focus on subpopulations of seniors, of older adults in New York, because we know that we want to, first of all, provide culturally competent services to our clients. And then also, we know that different populations have different needs. And in serving veteran clients, we want to ensure that our both our staff and the volunteer attorneys that we work with understand the benefits that veterans receive, understand where veterans are coming from and the challenges that they have in order to provide better services. And so that's who we are here at Vols and our Veterans Initiative that I'm representing today. And you know, and Toby had mentioned you know, some of my background, but I have been providing free legal services to veterans for over a decade in New York City as part of my practice. And so today I want to talk about end of life and incapacity planning, which really you know, is part of this puzzle that families and individuals face as they reach end of life, and obviously folks who are in hospice care are facing these issues. And so we want to make sure that people have the right documents that they need, right? That they are able to express their wishes and to make sure that those wishes are being carried out by the people that they love and they trust the most. And there's a lot of different aspects of that. You know, the questions we get are, you know, what's going to happen, you know, to my body after I pass away? Am I going to, you know, how can I make sure that, you know, I'm buried in a VA cemetery, or I'm not buried in a VA cemetery, or I get cremated, or whatever their wishes are? How do I make sure, if I'm unable to communicate with my doctors with respect to what my end of life choices are, that there are no unnecessary interventions that I don't want? You know, the things that Ashton was talking about before with respect to being able to be home in the community, instead of being in a hospital hooked up to a bunch of machines, if those are your wishes. And you know, how do I make sure that if I get so sick that I can't get to the bank and pay my bills and make sure the rent is paid, that none of those things fall off after I become incapacitated? And then also, how do I make sure that my wishes with respect to my estate, my belongings, my money, all of those things are honored after I pass away? And, we get these calls all the time, and folks are, a little confused about what documents that they need to make sure all of those different things happen. And sometimes they think that there's like one magic bullet, right? That they could just do one document that takes care of medical decision-making, financial decision-making, decision-making for after they pass away, decision-making for during their lifetime. And unfortunately, that's not the case. Unfortunately, you need a whole bunch of different documents to take care of these different issues. So what I'm just going to do really quickly, and in the interest of time, I'm going to kind of speed through it, is just walk you all through the different documents that we do, why we do them, and potentially some of the consequences of not having them. And so in talking about this, I'm going to split everything into two big buckets, right? The first bucket is documents that are important during your lifetime. And then the second bucket is documents that are important for after you pass away. And so those are the two big categories. In that first category, though, we have another split. And the first part of what I'm going to talk about is with respect to healthcare and medical decision making. And then the second half, I'll talk a little bit about financial decision making. And so when we're talking about healthcare decision making, we want to make sure that our clients, if they're unable to communicate their wishes, that they're able to name somebody to step into their shoes to be able to make medical decisions for them if they can't make them themselves. And so the document that we prepare is called a healthcare proxy. The person filling it out is the principal, and the people that the person they're appointing is their agent. And this goes into effect only when somebody loses capacity. So for instance, I'm my wife's healthcare proxy. If I was to accompany her to a medical appointment, the doctor's not going to turn to me and say, okay, you're the proxy. What decisions are we making? Are we doing, procedure A or procedure B? No, those are her decisions to make. And until she's unable to make them herself, I don't have any power as her agent under the healthcare proxy. And this is important because, a lot of times when people get ill, when people age, they become concerned that if they do these documents, that they're giving something up. And we try to reassure folks that they're not giving anything up, right? They're actually in the driver's seat. They are taking control of the situation by saying, this is the person I want in charge, and giving them instructions about how they should act. And that person doesn't come into the medical decision-making arena until they have to. And so that's important. So what happens if you don't have a healthcare proxy? Well, if you don't have a healthcare proxy, there's a law in New York called the Family Healthcare Decisions Act that dictates who's able to make medical decisions for you if you can't make those yourself. And, it's kind of a family tree that you would expect. If you have a living spouse, it's your spouse. If you don't have a living spouse, but you have adult children, that's your adult children. If you don't have adult children or a living spouse, and you have living parents, it's your parents and siblings, and so on down the family tree. And for some folks, that's fine and that works. But for other people, maybe the person closest to them doesn't fit into that, that regular scheme. Right. And for those people, it's especially important, if you have a life partner that you've never married, but that's the person who knows you the best, that's the person you want to trust with medical decision making, then you really want to have a healthcare proxy in place. But we recommend it for everybody, even if you are picking your spouse or your adult children, because, having that on file with your medical provider is important. Because they could just pull it out, it has their phone numbers on it, and they can easily contact that person if something happens and somebody needs to intervene to make decisions for you. The next document that we do, which is also with respect to medical decision-making, is the living will. And the living will, it's a little different because you're not naming somebody to make decisions for you. Instead, you're laying out what your treatment and what your care that you want or you don't want at the end of life. A living will only goes into effect when somebody is in a terminal condition, when they have irreversible brain damage, or they're unconscious and unlikely to recover. And then you lay out what kind of interventions you want or you don't want, right? I want to have cardiac resuscitation. I want to have, artificial nutrition and hydration. I want to have, pain management, or the opposite. And actually the opposite is where it really becomes important. So absent any clear written directions stating otherwise, and absent somebody as your agent under a healthcare proxy making decisions for you, the law will dictate that healthcare providers are under a duty to keep you alive by any reasonable means. And certainly people who have elected to go into hospice have clearly said, look, I don't want these interventions, or I don't want all of these interventions. And so it becomes really important for them to lay out those wishes. And even if you do have a healthcare proxy, even if you have somebody there that's going to step in and decide whether these interventions happen, it's actually nice to have a living will to provide them with guidance. These are tough decisions for caregivers, for loved ones to make, right? About whether to withhold treatment that's going to, bring about somebody's death faster, potentially. And, when you lay that out for them, when you say clearly to them, I don't want these things, that gives them often the reassurance that they need to be able to carry out your wishes. So that's the living will. And so with respect to medical decision-making, those are the documents that we do. There are other advanced directives out there, things like DNRs, do not resuscitate orders, DNIs, do not intubate, MOLSTs, which are medical orders for life-sustaining treatment. Those are actually all documents that aren't prepared by lawyers. Those are documents that are prepared by doctors. And so certainly that might also be appropriate depending on, the decisions that the person has made. But just to be clear about, what us lawyers do versus what medical providers do. So what happens when you have these things? These are like trees falling in the woods, right? If nobody's there to hear it, doesn't make a sound. We want you to send it out like a press release. Make sure your doctors and healthcare providers have that. If you are in hospice care, maybe you tape it to your refrigerator. People carry wallet-sized cards. So we want to make sure that that's out there. With respect to financial decision-making, when somebody has cognitive decline, physical decline, oftentimes bills don't get paid, they become at risk of eviction, lights get turned off. And so we want to make sure that caregivers are empowered to take care of those financial things as well, but also being able to get access to benefits, right? Maybe somebody needs to get on Medicaid in order to pay for home care services or a nursing home stay or whatever it is. You want to make sure that somebody is able to similarly step into your shoes, but this time, instead of making medical decisions, they make financial decisions. They pay your bills, they sign your leases, they apply for public benefits, they maintain your public benefits, those things. And so, the power of attorney really is super important because these things can lead to homelessness and really dire consequences if bills and other things don't get paid. And if you don't have a power of attorney and you become so incapacitated that you can't make these decisions for yourself, then your loved one might have to file for a guardianship. And so a guardianship is where you actually have to go to court to get the right to make decisions for another person who's unable to make decisions for themselves. And that process is actually really intrusive, really lengthy, and could cost actually a lot of money because you have to hire attorneys and all of that to navigate the court process. And so having a power of attorney in place can avoid your loved ones having to file for guardianship. And so to me, it's really one of the most important documents that we prepare for our clients. And then turning the page after people pass away, clearly there's no more healthcare decisions to be made. And powers of attorney are actually very explicit that when you pass away, your power of attorney ends with you. So now we have to have different considerations. So we want to worry about what happens to your property after you pass away. And for that, we do a last will and testament. And that, in that you name an executor, that's the person who's in charge. And then you lay out who you want your property to go to. Those are your beneficiaries. And if you don't have a last will and testament, then again, similar to the Family Healthcare Decisions Act, the law will say what happens to your property. That's the intestacy statute. And for some folks, that's fine, right? It goes to your spouse, if not your spouse, your children, and maybe that follows their wishes. But again, people have complicated personal situations, and maybe the people they want to inherit from their estate are different than what the intestacy statute has in it. So, for those folks especially, it's important to have the last will and testament to make sure that those wishes are clear and they're carried out, again, by the people that they love and they trust the most. The last document that we do for our clients is the appointment of agent to control the disposition of remains, which is a mouthful. So let's just call it the control of remains form. And in this document, you name an agent, you're the principal again, and this person is now in charge of what happens to your body after you pass. Do you get buried or cremated? Is there a funeral? What does it look like? And then also, if you have had any prepaid arrangements, right? If you prepaid for a funeral, if you prepaid for a burial plot or a headstone or whatever it is, you're able to lay out those pre-arrangements in this form as well to make sure that your agent knows, it's kind of the who's in charge, the what they're going to do, and the how they're going to do it. And if you don't have the control of remains form, again, the law controls who makes those decisions. And it's, again, what you would expect. And so if you have a living spouse, that's fine. They're going to be able to empower to carry out your wishes. But some people don't have those traditional family relationships, or those people aren't the closest people to them. And if somebody dies without a spouse, without children, and, if I was to show up, if I was to pass away and Ashton shows up to claim my body and they say, well, Pete's my friend, they're going to be like, well, we're not giving this body to you, right? And so that's the kind of person you want to be in charge of your final resting. It's really important for them to have the authority to do that. So I just want to highlight a couple of resources that we have out there, and I'm sure Ashton will be able to distribute this so you have the link. We recently did a collaboration with an organization called the Center for Urban Pedagogy, or CUP, and they helped us produce this really great brochure, Planning for the Future, that walks through each of these documents with great illustrations and really clearly helps people understand all of these documents so they're able to, properly plan for the future. And just a quick plug for our services. We do these documents for free for veterans age 60 and over who have low income and limited resources living in New York City. So you, or if somebody meets those criteria, feel free to reach out to us. We'd be happy to talk to you about doing these documents for you for free, or for your loved ones for free. Unfortunately, we only serve New York City. So for folks who are outside of New York City, I would recommend checking lawhelpnewyork.org. This is a clearinghouse for all the legal services providers throughout New York State, and you should be able to find providers in your local counties. I know it's a lot, but we have a lot to pack in for this program. So I will stop there, turn it back over to Ashton, and I'm happy to stick around at the end and answer questions.
That's terrific. Pete, thank you so very much. And that document sounds amazing. I would love to get a handle on a few of those, the planning for the future brochures. Those look awesome and would be very helpful for the veterans and the families that we serve. Going to turn it over to a new portion of the program. We will answer some questions toward the end of this program, but this is the conversational portion. Welcome Senator John Brooks back, New York State Senate District 8, the South Shore, Eastern Nassau, and Western Suffolk counties. And we are going to talk about a few things. Most importantly, some of his legislative leadership as the chair of the Committee on Veterans, Homeland Security, and Military Affairs, with turning the New York State Division of Veteran Services into a department. I know that was incredibly important for many veterans throughout the state. And Senator Brooks, I would just like to know what you envision for this new elevation for the division to a department.
Good afternoon, I guess, right? Thank you, and it's great to be with you today. I think this is a very important accomplishment. I think, in my opinion, at least, for far too long, the veterans did not get the attention they should have gotten in the state of New York. They were an afterthought. You know, that maybe that's a little too strong. But in the last 4 years that I chaired the group, we really put attention on the needs of the veterans. We recognized New York State has a significant veterans population. We're in a situation, certainly we recognize for the Vietnam vets in particular, the path of that war, if that's the right term, really for those involved in the closing days of that war, closing years, they really did not get the respect. You know, I was in the service during that period of times. At times, if you were traveling, you were told not to wear your uniform, or if you're leaving an armory, take the uniform off before you leave. And those veterans, when they returned, did not receive a welcome. You know, we went to a lot of trouble, not trouble, that's the wrong word, but we did a lot of research on the needs of the veterans that we had. You had the folks from Vietnam that had a lot of challenges. The WIA program was established to address some of those needs. An incredibly effective program that's had great success, both male and females, in reducing suicide rates and the rest. Most recently, the governor's office basically took over the funding of that program. We used to work for years. But all in all, you know, we have thousands of veterans in this state. We had a relatively small department. By elevating the department to a full department from an agency, you're going to have the needed staffing. There's a lot of recent legislation that we passed and more that's needed. There was a discussion before about burial rights. We now have a state military cemetery, which we didn't have. So if somebody is indigent, there is a place for them to be laid to rest. We have expanded benefits programs across the state to both active and former military personnel in terms of different discounts from a tax standpoint. And other programs. Much more needs to be done. Here on Long Island, for example, we have the state home out at Stony Brook. We have a nursing home rather out there. Nursery, that would be quite a deal. A nursing home out there, and we have a daytime program for veterans. I'd like to see that expanded across the state. We've done a lot to try to recognize our veterans. And, you know, for me, when I was asked to take over the Veterans Committee, and while I was in the service and while I served during Vietnam, I was in the reserves. Our unit was not involved in any of the activations. I felt in many ways not qualified to take that service, but conversations with many veterans convinced me otherwise. And for 4 years, we really tried to put the veterans in a critically important position. We probably passed more legislation for veterans in the last 4 years than we did in the last 20 or 30 years. And I made a point to make the committee totally bipartisan. So it was critically important. Last year, each year we'd have the troops come in from Fort Drum and the cadets from West Point. Last 2 years with the COVID situation, or last few years, we weren't able to do that. We did go out to Drum last year in the fall. The committee members that could make it, we had a chance to tour the facility, which has dramatically changed from when I was there in the 1800s. And just to see how much technology has advanced the military. We had an opportunity to go to Syracuse University and see the tremendous assistance that Syracuse is giving to veterans who are there for education in other regions. So, I think, I guess if I look back, I think veterans are in a better position 4 years ago than they were when I had an opportunity to chair the committee. I take great pride in that. I think our veterans deserve only the best. I think we've not taken some steps, but more is going to be needed. Many of our veterans facilities, Legion halls, veteran halls, the rest, they're having trouble maintaining those facilities. Money is tight, and we have to provide assistance so that we can maintain those facilities. One, it's important for the veterans themselves, for a place for them to have, and in many, many, many places. The veterans or the Legion Hall, that is a gathering point in the community for different events, and people maybe that are challenged financially, that's where a wedding is held, or a 100th birthday party, whatever it might be. So I think we have to do what we can to save those. Most importantly, I think as I look back to the Vietnam vets in particular, and how they were welcomed home towards the end of that war, and I use that tongue in cheek, they weren't welcome home, they were abused. They led by example. When there were other activations, the Vietnam veterans made sure that those that were returning home from those conflicts got the welcome home that they should have got. If someone was lost, they have troops escort those individuals to their final resting place. So I think the Vietnam veterans in particular really made a point to show how much we had forgotten what our veterans do. All that we have comes in the end from our veterans. They're putting their life on the line to risk and defend this country. Makes everything that we get possible. And these men who didn't get the respect they should have gotten, they had enough pride in themselves, and what they did is to make sure everybody else had it. And I really, I've tried to dedicate the last 4 years to making sure we're helping veterans where we can. We put many, many good programs in place. We have other things on the drawing board. Hopefully they come to pass. But I think elevating the department was a way to ensure that we're in a position where we have an agency that's properly staffed and can address things. One of the things I wanted to get accomplished, I hope maybe does get accomplished, is I wanted to put together an electronic bi-monthly newsletter for veterans across the state, so they could be aware of any new veterans programs or events that are coming up, or maybe have a place that where can I get this or how can I get help with that? You know, only 17% of our veterans in the state take advantage of the benefits that are available to them. And I think a lot of them is the fact that many of them don't know. So by having that newsletter, and it doesn't cost the state anything, I run a newsletter out of my Senate office. Each week we send a letter out to people. You have somebody scripted out whatever message you're giving. You hit a button and it's there. There's no fees. But I think it's important that we do that for our veterans, so they realize, hey, we still remember what you did, the service that you provided. And by the way, did you know that if you're in need of this or that, or there's this program coming up, or there's going to be an event coming up for veterans, that you can take advantage of it. So I'm disappointed that we're moving on as a result of the election, but I take great pride in what was done, and I in particular take pride that this committee was run on a bipartisan basis. We got so much done, and it is a message to the people in Albany that if we stop the party politics and think about the mission that we're there for, how much more we can get done. I think everybody on that committee recognized that it was a bipartisan situation. It didn't matter, Republican, Democrat, whoever came up with the idea. We'd work to improve it if that was necessary and pass it regardless of party. And I think the veterans across the state benefited from that.
I would concur, Senator Brooks. And just to highlight some of the other amazing accomplishments that you were involved with over the last 4 years, the Restoration of Honor Act, which was passed in 2020 and signed by then Governor Cuomo for people who have another than honorable discharge for sexual orientation, gender identity, MST, PTSD, and TBI, which is huge. And the state of New York will review their appeal, their story of what happened to them and why they were discharged, and grant them an upgrade to honorable and grant them access to New York State veteran benefits. In addition to that, it's hugely supportive morally, I think, for those individuals. The one thing that was left out of that has been addressed. The people who have worked for the state of New York and retired, even if they were able to get that upgrade, they were still not able to get the 3% pension buyback from the state of New York until Senate Bill 6022B was passed and signed by Governor Hochul on Veterans Day. The retirement and Social Security law for discharged LGBTQ veterans who have an honorable discharge granted by the state of New York now can get that pension, which is huge. And addressing the issue of brick and mortar for veteran VFWs and American Legions and other VSOs, the New York State Capital Program is offering $5 million in increments of $25,000 to $75,000 to make those repairs. Again, for veterans, huge, announced on Veterans Day. And the State Division of Veteran Services deserves to grow. They do incredible work. I stand behind this decision personally as a veteran myself. I think it's going to make a big impact on a lot of people. And getting back to the veterans who served in Vietnam, who are aging now, we see a lot of Vietnam veterans in our program for hospice and palliative care. And one of the things that's crucial for them when they're getting home hospice is support for the caregivers. MJHS has a lot of tools and resources for that. In addition to our interdisciplinary team, we have resources for caring for yourself as the caregiver, which is very important, and it's often forgotten about a lot of the time by the caregivers. We have bereavement support when the time is appropriate. And as a level 5 partner with the VA's We Honor Veterans program, we have resources to support caregivers, especially those caring for veterans who have dementia exacerbated by resurfacing PTSD issues, which takes a lot of families off guard because a lot of the times the PTSD has not surfaced, it's been repressed, and then the dementia brings it to the surface. And that can be very challenging. And sometimes we're able to provide these tools and resources to just explain like what's going on to the caregiver, and it's been incredibly helpful. The VA's got wonderful programs for the caregivers as well. And so we have a very close relationship with the VA and try to implement those services and support systems for veterans and their caregivers. I am mindful of the time here. I just wanted to know about your vision of the state, like what is missing? What is dear to you, Senator Brooks, that you would really like to see happen in the future with the Veterans Committee?
Well, I think we're on our way, to be honest. I think I'd love to see what's being done, and Syracuse University expanded to additional colleges across the state. One of the great things that Syracuse has done is to recognize that your military occupation has value. And by that, I mean, you learn a number of sets of skills. And they're in a position, and I'll say, just use medic because I was a medic. When you apply to go to Syracuse University and you show that you were a medic, they have a number of college credits they'll give you, understanding the training and the education that you've received from your service. So you're in a situation, and particularly if you're going to start college later in life after you've done your service or pick up where you were, that's a big jump in getting your degree. But they also have counseling and space and assistance available for veterans there. If you ever go up there, it's a unique building. They take you for a tour of the building, and they never say anything about a certain item. And then at the end, they'll say, if you notice, you haven't gone up or down any stairs. There are no stairs in that building. It's designed to accommodate people that are handicapped. And their auditorium, when there's hundreds of seats that can be removed, where individuals can go in and with a wheelchair. But I thought it was unique. You didn't even recognize as you were going through the building, you were walking up in a spiral circle. They put a lot of attention there. And I think more attention is given to the vets. And I do appreciate, Ashton, you pointing out some of those bills. I wasn't going to sit here and start to do a punch list because, you know, sometimes bills were aimed at particular veterans and the problems that they had. And sometimes it's things that were forgotten. And I think, you know, not meaning to be critical, but I think the Vietnam War in particular became such a political issue in the United States that we forgot the people that were in it. We took exception to the politics, but the men and women that were in the battlefields were still in a war. A war that was very difficult, and at times you didn't know who the enemy was. The nature of the fighting was different than we'd seen before, guerrilla fighting and things, and the use of napalm and other things had catastrophic results later. And I think not for anyone more than the Vietnam veterans who really effectively brought this to my attention as we watched stuff. And I know anytime I've gone to a funeral with a veteran and the motorcycle guys or whatever ride along with that, I make a point to thank them and to thank them for their service, because in Vietnam, we as a country did not give respect to these men and women who put their lives in line, whether you liked the war or you didn't like the war. They were doing what they were told. They were taking the orders from the commander in chief and not questioning what was being done. So, you know, the Vietnam vets, there's still a large number of them there. we owe them thanks for what they did. And we owe them thanks for the fact that they recognize everybody that is coming home from whatever deployment has been ordered for what they did. So you know, I'm disappointed not being there beginning next year, but I'm very appreciative of the opportunity to work with the men and women on that community and really make up for a lot of lost time. There's more to do. I think this newsletter will help. I think expansion of services for our veterans will continue. And I think we have to recognize that while there are a lower number of people in the military today, and those who serve in the reserves are seeing more activation, probably about a 3-year cycle, give or take, where they go on duty. We have to recognize that when a reservist is on active duty and he or she has family at home and kids in particular, that we need to be mindful of those kids. And one of the things we talked about with some people was the fact that the concept that teachers are made aware that a parent is on active duty someplace in the world, and to be mindful. And if their parent is stationed someplace in the world, and that morning there's a news report that there was a bombing in that city or something, that child needs to be given some attention, because he or she, his mind is going to be on mom or dad, and that information is not going to be there. So I'm thankful for the privilege of serving on that committee, and I think we got some good stuff done. So thank you for an opportunity to speak to you today.
Well, thank you, Senator Brooks. We were going to turn it over to Q&A in just a sec, but I just want to let you know that we've got these amazing proclamations from Governor Hochul for Vietnam Veterans Day that we make part of our veteran recognition ceremonies that we offer veterans and their families in our program, because it means a lot to us, that service. And for those who didn't serve in Vietnam, we have Memorial Day proclamations and Veterans Day proclamations, thanks to Governor Hochul, who sent us a stack of them just the other week. Service means a lot. The courage that it takes to just put on the uniform and go through and boot camp training and then go to war, oftentimes, it's huge. And so trying to repair injuries that are sustained from those individuals and their families, sometimes really late in life because they haven't addressed it until now. It's really important work. We do have a couple of questions here. We do have a few minutes left to address them. I saw Toby, you raised your hand earlier. Do you have a question that you want to start with?
I was applauding Senator Brooks.
Okay.
No, I had a question that I did send to Pete, but there was a question that was actually posted in the chat. I'm curious to know what additional advice on planning you would have for someone who's married versus someone who has a domestic partner and not married. Pete, is there anything you would want to highlight from what you spoke about earlier?
Yeah, that's a great question, because as much as we recognize domestic partnerships, it falls short of marriage in the eyes of the law often. And so depending on what situation we're looking at, they're not the equivalent. Actually, for somebody who passes away, a domestic partner is not treated the same as a spouse under the intestacy statute. So that becomes very important. But they are treated similar to a spouse with respect to claiming somebody's remains. So it really just depends on the situation. But I would encourage folks in that situation, whether they have a domestic partnership or they're just in a long-term relationship that hasn't been recognized by the law in some way, that for them there's a more heightened importance on getting these documents in place, because really it is a different situation for them. And just to throw something in really quickly, and so happy to hear Senator Brooks and Ashton just talk about Vietnam era veterans. Looking at the demographics of veterans in New York State, it is over half of the veterans in New York are over the age of 60. And it is a graying population. And so the percentage of folks that are older who have served is growing. And so these concerns are even more important and should be highlighted and addressed.
Thank you, Pete. Before we take the next question, I just want to ask Rosie, would you put up the post survey? It's just another 4 quick questions if our attendees wouldn't mind taking a moment to fill that out. And Helene, I think you had your hand up first.
Yes, hi, how you doing? My name is Helene. I'm the co-chair of CB7's, the Veterans Committee. What I wanted to ask, I heard him speak about a newsletter, which is great. And in the newsletter, will they have anything about suicide awareness for the vets? Oh, where did my camera go?
Yeah.
Oh, and suicide awareness is very important, and it's not talked about as much as I noticed with the vets. How can that be incorporated inside of the newsletter, and how could we get put more awareness to it?
So the idea of the newsletter would be severalfold. One, give updates on any new benefits or programs or concerns that are out there. If there are events taking place, if there's jobs available specifically for veterans, and then there would be, if you will, feature stories that would discuss certain things. Suicide obviously is a big concern. Dwyer program in particular is working on that, but there are others too. To give updates on that, what it really was is an effort to make sure we touched every veteran in the state, and then tell them what's going on, and if there's something that they need help with, they could write in and get some research. And then I think we do specials on people dealing with different things, or for example, right now with the stuff going on with Zoom, to try to do something with that. So,
and one more last question. I heard you mention about the school system with the children that have parents in the war, have parents. That's a great thing, because teachers don't put highlight to that. If the child starts failing in school or acting out of school for some reason, they don't put highlights to that. How can we bring that awareness to them? Can you hear me?
I'm sorry. Unfortunately, my doctor's office called, so I couldn't take clear. So I only got some of that. Can I ask you?
I was saying that with the it was a great thing what you mentioned about the school system and the children in the school systems of veterans. How can we bring that awareness to the school and to these teachers? Because sometimes they think the kids are just acting out, and you have children that's not going to speak about anything, or that's in how can we bring that awareness to the school system?
Yeah, so the whole idea was that the military, in fact, would reach out to the school district to know that, Sergeant Jones is an active member of the reserve or whatever it might be, and has been on military duty. And then there would be training given to the teachers as to how to monitor those students. And again, like I said, the concern in particular is you hear, there was a bombing at a military post wherever, and the child hears that on the news, no idea what's happening, goes to school with those questions in mind, and the teacher, Billy, you're not paying attention or whatever. Well, no, his mind's thousands of miles away. So I think we do have legislation proposed that outlined how that would be done. I think it's something critically important. I think it's training teachers should have that on how they should handle a student that's whose parents are on active duty, and particularly where there's some kind of an event that takes place in that area, to address that, and how to treat the other students too. So that's a bill. Unfortunately, we didn't get enough attention. We couldn't get that moved, but I think it is something that's incredibly important, particularly as we become more and more dependent on reservists to fill our military needs, if you will.
Thank you so
Okay,
much for
thank
answering
you.
that. We've got we're at time. I'm being mindful of everybody's time here, but Mayo, you had your hand up as well. You want to ask a quick question?
Just quickly, Peter, could you post your phone number again? I missed it. This has been fascinating, and I'm sorry I missed the first portion. I'd like to just say the New York Harbor Healthcare Hospital at 23rd Street is, I have never had better healthcare in my life, and I would like to thank the senator and the people behind that make that hospital possible. Every American should have access to that kind of healthcare. The funding for the VFW, when I came back, we were invited not to join. We were not a real war. We were a counterinsurgency effort. And it was made very clear to us that we were not welcome. It should be supported. It is a necessary and helpful thing. So I'm glad that's happening. This has been really great, and I'm happy I came. And thank you very much for all that you do. Thanks, Ashton.
Thanks, Mayo. I'm Jad. I'm going to close it up.
Yes, hi, thank you. Can you hear me? Testing. Okay. Hi, Senator. My name is Amjad Mujahid, Marine Corps veteran, Department of Health, Mental Hygiene, Bronx Neighborhood Health Promoter. And I wanted to ask you, has there been any talks in terms of veteran transitional housing oversight for the state, and in particularly New York City, which is much needed? Do you have a lot of organizations who are doing their best to try to provide homeless services and transitional support services to veterans to get them, stabilized and things of that nature? However, during COVID, we saw a lot of gaps in services from these different organizations, and it's like there's no governance to help them to maintain a level of quality care and service delivery that needs to happen for the veterans to be successful in getting back, stabilize their personal life, and to be productive in society. So can you share with us any efforts along those lines for oversight? And if not, how can we start that conversation and put in the legislation needed so that we can improve the health and wellness of veterans and their families in these programs? Thank you for your time.
Sure. So there was some discussions. It wasn't we tried to do some things on a local level, but to your point, because of COVID and what was going on, we ended up with a housing crisis statewide, if you will, and there wasn't anything specific to the veteran per se versus anyone else. We realized that many people were not working and the rent situations and that was up there. So I believe that is an area that should resurface. I think, we should be providing housing. At one time, we had an outbreak, if you will, in New York State of abandoned housing. And that was an opportunity. We should have been stepping in, grabbing those houses as soon as somebody left, making that whatever repairs were needed, and making that available to veterans. But if I was going back, that would be an area I'd be working on now.
Well, thank you so much for answering that. Rabbi Yehuda, do you want to ask the final question?
Yeah, Rabbi Leonard Blank. I'm a Vice President of Professional Development and External Affairs for the Rabbinical Alliance of America and a former member of MJHS staff. First of all, I want to commend the Senator and MJHS for promoting and caring with tremendous sincerity all the issues and concerns of veterans. And also, as the Senator had mentioned, regarding those who served in Vietnam, I think it's always important to educate those who were not born or too young to remember the Vietnam War, that the veterans served with tremendous distinction as Americans. And that's always something to promote and to convey to America. Unfortunately, those who returned from Vietnam did not receive the welcoming as veterans of other wars. And we always have to promote the care and concern that they serve with distinction as Americans. The other I also want to mention, I have officiated at many funerals through the years and facilitated families of those who are veterans who were deceased to ensure that they had proper burial at either the major cemeteries that belong to the United States, and also at their own funerals. And I was surprised very often that there are many families were not aware of the services and things that are offered to veterans, and just even the honor guard that was available. And I would facilitate and ensure that that was done properly and respectfully. So I just want to mention that it's always important to let family members know, and funeral parlors and chapels, that if a deceased person was a veteran, that he is definitely can have the tremendous honor and distinction that is being given to those who served as veterans in the war. So I just wanted to mention, again, thank you so very much to all of you for the care that you give to our fellow Americans. And it's something that you should be blessed for many years to come. Thank you.
Thank you, Rabbi. I want to thank you all for joining us today. Pete, Senator Brooks, you were both tremendous. Thank you so much for your time and presenting today. A really powerful program. I just want to also point out that Pete and I will be working together again for the Live On New York conference. We'll be presenting together in January on the 26th for the Building the Future Together workshop. So I'm very excited about that. I wish you all a very happy holiday season. Hopefully we'll see you at a future Vet-to-Vet Café, and please keep in touch.